Okay, Dr. Rob Muller. So why do people have a hard time opening up about trauma, even with their therapist?
Well, I mean, I think one of the things about trauma is that it really has a huge impact on your ability to trust. I mean, this is something that would be probably in many ways obvious to listeners. I mean, when people have really suffered from interpersonal trauma, they've really been affected in an emotional way, in a way that impacts their sense of how they think about people, how they think about the world of relationships, how they think about their place in relationships. And very often, what you have is this tendency to want to protect yourself, to want to hold back, to want to feel safe. So often, when people have had trauma experiences, they have felt unsafe. And then afterwards, they have felt unprotected very often when they've told other people about their traumatic experiences, either gaslit or having their experiences minimized. And so there's a tendency to really struggle with trusting people. And so opening up in many ways is, you're asked as therapists, we ask clients a lot when we ask them to trust us, when we ask them to open up to us, we're asking them to take a risk. It's scary. It's something that could be potentially dangerous in some ways, emotionally dangerous. And so, yeah, they hold back, and so opening up becomes a real process, and it becomes a real challenge. We have to pace the process, take it in a very slow, measured way. And when we do, though, when therapists do, so I'm speaking about we, meaning therapists, because I'm speaking from the perspective of a psychologist working with trauma clients. When we do that, when we take it slow, when we pace the process, then people are in fact able to open up. And there's a part of them, of course, on some level, that really wants to be understood, that wants to be given an opportunity to open up, that wants to be able to lift this burden off their shoulders, this trauma that they've been carrying around, this secret, this struggle that they've been carrying around. They want to lift that burden off their shoulders, but it has to be done in a way that is measured, that is paced. Yeah, so that's why.
God, yeah. So it seems like the main thing here is that they've told people about this, or they've slightly mentioned it, and they've been gaslit, and then they've pretty much got a response that made them feel like it's not safe to truly open up. So because of that experience, they tend to kind of, like become a bit, fully aware on how to keep themselves safe, and not feel like, I guess, they're not worthy if they open up and truly tell people about how they're feeling, right? It's just the whole concept of they just didn't feel safe telling people. Is that the main thing, or
Yeah,
is
for
there
sure, for
anything
sure.
else?
Well, that's probably the main. Yeah, if you're going to put it down to one word, I would say safety is the big one, and I agree with you. Sometimes they have tried, like, I mean, it's interesting. Some people who have trauma histories from a young age, let's say, or from even, let's say, their teenage years, they have tried telling a friend, or they have tried telling a boyfriend, or they've tried telling a parent, or something. And yeah, sometimes people respond well. So that's, when people respond well, that makes a whole lot of difference. When people don't respond well in response to that disclosure of a trauma history, that can cause the person to clam up then for years and years, and then they really feel stupid for having shared. They'll blame themselves. They'll even, they'll say, I'm such an idiot for, like, why did I trust someone, like, why didn't I just leave well enough alone? And so, yeah, it really makes a big difference how people respond, and that sense of safety is very important as an emotional kind of experience. So, yeah.
Got it. Okay, now what would you say is a healthy response to give someone if they do seem to like show that they're trying to open up, but they're kind of, just like testing the waters, right? Like, what would you consider a healthy response if you are working with a person like that?
So you're talking about therapists, because I'm not exact. Are you referring to therapists working with people like that, or are you talking about friends or family members?
Hmm. Pretty
What?
interesting. So would it be different for both? Because I guess there might be some similarities, right? Like depending on who you're talking to, or is it actually going to be different based on who you're
Yeah,
working with?
yeah, it sure will.
Okay,
So like
you can,
when
yeah,
you're talking about people who have trauma histories, very often they have tried to share that with friends and family members, and friends and family members often don't know what to do with this information. They really don't. This trauma disclosures can actually tear apart a friendship. When people find out something about their friend that they never knew was real, and then all of a sudden there's this, looking at them in a way that they never looked at before. Some people will not respond very well to it, and some people do respond well. I mean, it depends on the kind of friend you have, depends on the family members. But these are people who are not trained. They're usually not, they don't know how to respond. And so you often get family members saying things like, trying to be positive, and coming from a good place. Of course, you have family members who blame the victim, and that's terrible when that happens. But
yeah,
even if you have family members, let's say if somebody tells a family member that they were raped in university, they tell their older brother, let's say, or something like that, they were raped in university. Even if he's a good guy, even if he's trying hard, they're not trained, and so they might make all kinds of mistakes, such as, excessive positivity can be a very common mistake. Well, you're doing okay now. Don't worry about it. Try to turn a page. Try to be positive. Don't be negative about things in life. And it's coming from a good place, like they're trying to be helpful. But when a trauma survivor hears a family member become very positive about the person's trauma experience, like kind of like say, well, try to be positive about it. Listen, bad things happen to everybody. You'll get over this. I think you'll be fine. That kind of thing. That can be felt to a trauma survivor as a very minimizing response. It can be felt as though the person is, you know, shutting them down, doesn't want to hear about it. And very often they feel foolish, actually. So what might be intended as a positive kind of response from a family member trying to be caring and loving might actually really backfire. And again, these are individuals who aren't trained to deal with trauma. So what do therapists who are trauma informed know how to do?
hmm,
They know how to really, or they're trained to really listen. They're trained not to make assumptions. They're trained to slow down. Somebody shares with someone who I've been working with, let's say for 2 or 3 months. Let's say they came in because of symptoms of depression or anxiety, and they've never shared with me anything about their trauma history. And after a couple months, they begin to trust me, and they start to open up and start to share something about their past. As a trauma-informed therapist, what I want to do and what I would teach all my students to do is more than anything to listen, to slow down and listen, and to ask the person what the experience means to them. So let's say it's that same example I gave you of a young woman who was raped in university. And she, I have something to tell you, Dr. Muller. Actually, last year when I was in university, this is what happened. I would, I would slow down the whole thing and say, well, okay, tell me about it. And I wouldn't make assumptions. I wouldn't necessarily make assumptions that she's going to get over it. I don't know if she will. I wouldn't make assumptions that I wouldn't make any assumptions at all. I wouldn't even make assumptions about what she must be feeling. I wouldn't necessarily say, "Oh, you must be feeling devastated." I wouldn't say that either, because I don't actually know what she's feeling. And that's another mistake sometimes people make, is they assume, they go the other direction. Rather than being overly positive, they may be overly empathic. Oh, that's horrific. Oh, how terrible. And the client's, well, I didn't say it was horrific or terrible.
yeah,
I mean, I'm feeling weird about it. I'm not sure what I feel about it. And they might have lots of complicated feelings, especially if someone was sexually assaulted by a boyfriend or a girlfriend. it can be complicated what they feel. They might feel angry at them, but they might feel guilty, and they might feel all kinds of things. We just don't know. We don't know what they're going to feel. And so a trauma-informed therapist slows the process down and responds with curiosity and compassion. Okay, so I'm hearing you say such and such happened. As you tell me that story, what do you find yourself feeling? And I don't know what they're feeling, but whatever that is, I'm curious about it and I'm listening, and I will follow their lead and I'll see where it goes. Um, that's not an easy thing to do if you're a family member or you're a friend, right? I mean, you're not trained in trauma work, and of course, people are going to try to be helpful in the best way they know how. And so I don't fault anybody if they respond however they respond. But it can be tricky for trauma survivors because very often, while on one hand, they know that they should be talking to a therapist, sometimes people aren't ready for that. And they find the whole idea of talking to a therapist very scary. And they want to tell their boyfriend, about what happened a year ago, or they want to tell their buddy. And it can be complicated.
Got it.
Yeah,
Yeah. So it seems like, obviously when you're working with someone who is trained, like yourself, the whole idea is to not put words in that person's mouth, right? Like get them to truly figure out what they're feeling and let them put words to it without you just diving in and kind of telling them how to feel, right? Yeah.
exactly,
And then now just a
exactly.
quick question. So many people, if they hear this, like they might be a bit confused on why it's not helpful to be positive. Cause like that's something that people always try and do, right? Just, like be positive, like something is, or like if something happens in your life that's not good. So just to zoom in on that, why is it not helpful to be overly positive? How does it make the trauma survivor feel?
That's a great question, and it is tricky because obviously there's research that optimism is a helpful characteristic psychologically overall. We there is good research on that. When work this comes to the idea that trauma informed work in psychotherapy is a subspecialty. It's not exactly the same as doing regular psychotherapy. Most of the principles of regular psychotherapy, yes, do hold, the majority. But then there's a subspecialty or a sub area of skills that trauma therapists need to know. And this is, and you've hit the nail on the head on one of the most fundamental aspects, which is that with trauma survivors, for them to feel safe, to be able to explore a variety of complicated mixed feelings, they first need to know that you validate their experience, that you get it, that you're listening, that you don't minimize their experience, that you hear them, that they have suffered. And this can be tricky, especially if the therapist feels as if the patient is making a big deal out of nothing, whining about things that they wouldn't feel would be a big deal, et cetera, et cetera. So you might say, well, what kind of therapist would do that?
Mm-hmm.
Well, therapists are human beings, and everybody gets triggered by something, and therapists are included in that. And so I give a nice example in my most recent book, Trauma and the Struggle to Open Up, about a situation where somebody loses their dog. Their dog dies. And some therapists might minimize the experience of the loss of a pet. They might not view that as traumatic. And I'm not trying to say that in the world of trauma comparison, losing a pet is equivalent to other kinds of traumas. I mean, trauma survivors do this all the time. Is my trauma worse than yours? When they're in group therapy, it sometimes becomes a challenging thing because people compare their trauma experiences, and that can be a real challenge. But at the end of the day, when you're actually working with people in therapy, it's very important to take their suffering seriously, not to get into this whose trauma is worse than whose trauma. People will say, oh yeah, I just lost my pet. Look, I mean, there are people who are refugees from Syria, and they're the ones who've really suffered. Why am I sitting here? Trauma survivors themselves might invalidate their own experiences and say, I don't deserve your your time and your specialty and your whatever. I'm just an idiot who lost his dog. What's the big deal? They might say to themselves, or they might even say it out loud. I've had clients say things like that to me. And I will say to them, look, I'm not here to compare whose suffering is worse. That's not my job. Sure, there always are people who've suffered more than you. But when you tell me the story, what I'm hearing is that this pet of yours was your best friend. And when I think about the idea of losing your best friend, no, that's not a small thing. That's a big deal. And if you're feeling depressed about that and you're suffering and you don't know what to do and you're finding yourself still struggling even months later, that's something we need to take seriously. And so I'm not sure if I answered your question, though, or if I sidetracked myself.
No, that's fine, because like you did mention quite a bit there, but like we will cover all that, because like you talk about in the book how you have like different ways to approach like therapy and just like really help the client feel comfortable.
I know, but you asked about toxic positivity, and why is that a problem? Because at the end of the day, when people jump to the idea of being too positive too quickly, what they've done is they leapfrogged over validation. And so what happens is if somebody says, well, right, no, I understand you lost your pet. Look, at the end of the day, you can always get another pet. And at the end of the day, it's not like you lost your family member. So what ends up happening is they're trying to be helpful. And what the trauma survivor feels, so let's define that person as a trauma survivor, if they themselves are really suffering because of that loss, that trauma survivor would literally just feel foolish. And they might even say, yeah, you're right. I don't know what's gotten into me. I'm making a big deal out of nothing. But deep down, they just feel foolish and ashamed of themselves. It actually makes things worse. It actually makes things a lot worse, actually, when people invalidate. Because then what they feel is not just the suffering for what happened, but foolish for having that suffering. And so it's really actually quite problematic. And so what has to happen is first the person has to feel that they have permission to feel whatever they feel. And if that's loss of a pet and that's depression because secondary to that, okay, so then that's what that is. You work with them where they're at. You actually listen to them and follow their lead and work with them through that. And then you see where they go. And what ends up happening is that if you listen to what they're going through, there's a natural desire. Nobody wants to stay in their trauma forever. That desire to be able to come out, to be able to see light, to be able to move forward, to be able to find a future, that part of the person is there. It just takes a while for that to come out. And then when that does, you can help them move forward, but you just have to be patient. You can't jump to that too quickly.
God, yeah. So it just pretty much makes the person feel like they haven't been heard, right? And then you mentioned that this can pretty much lead to them even telling themselves, oh yeah, like it's not even a big deal. Like, why am I sad? Like, why do I feel this way? Because they've not been validated, right? Which is not a healthy way to cope, right? So just quickly, so just so that people, if they are watching this, if they want to, slowly look at themselves and try and figure out what other coping strategies they've possibly been using which aren't healthy, what else would you name? Because obviously one is just them telling themselves, oh yeah, like it's not a big deal, but they still feel it, like it's still a heavy feeling inside them, right? Which is why they're not in a healthy mental space, right? So like, what are other unhealthy coping strategies that you've noticed that your clients have had to kind of get away from the feeling of feeling bad?
Right. So addictions is a really big one, and there are a variety of addictions that people engage in, and sometimes they don't even realize it. I mean, obviously, they're the well-known alcohol and substances as a way of numbing their pain, numbing their suffering. But of course, porn addiction is also a common one nowadays. With the accessibility of pornography, so being so easy. Workaholism is another very common addiction. Sexual addictions. These are very common things that people try to cope with trauma, but it at the end of the day, it doesn't really help. What are some other
Yeah.
ways that people will cope? Like I say, toxic positivity, I think, is one. So we've already mentioned that. Um, I think uh, it also is the case that many people, based on looking at things online, have become accustomed to, not accustomed, have gotten into trauma as a there's a space online for trauma survivors, and some of it is very helpful, but some of it is not so helpful. And so what is the stuff that's helpful is obviously information that relates to accurate ideas about mental health and about PTSD. But there's also a kind of whole online space that relates to adopting the identity of a trauma survivor. And I find that that's not so helpful either.
Hmm.
So where people come
Yeah.
into things like, uh, you know, uh, men who get excessively involved in the manosphere, women who get involved in the man-hating
Yeah.
online world.
Hmm.
Um, all people are like this, all men are bad, all women are bad, that kind of stuff. And it's very easy to find. I mean, I don't know what it's called online nowadays, but I know, patients of mine have told me about this, and
Yeah.
it's not actually that helpful. And then there's a kind of a whole sort of online trauma world. And again, some of the information is very good, but some of it is not good. And it kind of reifies messages about, you know, um, uh, that sort of sound good on the face of it. You know, don't don't let men push you around. They're just being toxic and blah blah blah. And they'll throw around language like toxic and narcissism. And again, I don't want to undermine. There's really good literature on narcissism. I
Yeah.
use the word toxic. It has a specific meaning, and it's a helpful word. The problem with some mental health language is it can be just taken and turned into a kind of identity. And people can come to this idea of, I'm just a trauma survivor, and that's all I am.
Yeah.
And everybody needs to acknowledge that. And there's nothing else for me in this world. There's no other space for me. I just always need my suffering acknowledged. It's not a great space. And if psychotherapy leads you to that idea, I say get a different therapist. That's not psychotherapy. So this might seem contradictory to what I just said earlier on, because I said you really need to validate the
Yeah.
patient's experience. But validation is part of the story in psychotherapy. Validation is absolutely critical. And if trauma survivors don't feel listened to, don't feel their experiences are validated, don't feel that their suffering is taken seriously, they won't be able to improve. And then what? What do you do after that? You help them find a place for themselves in the real world. It's not just, you know, about your suffering was what happened to you and that's the end of your life story. No, that's a chapter in your life. And it's a difficult chapter and a painful chapter, the trauma that happened to you. And it's a chapter that will influence all other chapters. However, it's not the grand total of all other chapters. You now have the ability to write the next chapter of your life. And what is that going to look like? What place is there? And they might say, but the world is so fucked up. And I say, yeah, it is. So the question isn't trying to change this fucked up. I mean, maybe a little bit, maybe a little tiny little bit, but
Hmm.
mostly no, it's a fucked up world.
Yeah.
The question is, what's your place in it? What's your place in this world now, here and now, given what happened to you? And that may seem like a hard question, and we may not have an answer today, I might say to the client. We might not, but this is a question I'll keep coming back to. What is your place now? And different people, and you might say to me, well, I can't find a place. And I'll say to you, I hear that a lot from trauma survivors. I don't know what place I have. And I'll say that is part of a trauma history. But I've been around the block before, and I've been around the block with many patients, and we can work together to find a place for you. I don't know what that's going to look like. I actually really don't, I might say to them. But that's part of our work together, is finding a place in this otherwise fucked up world. And
Got it.
and that's really a question about their future. That's a question about it's a strength-based approach. It's saying trauma is part of your identity, but it's not the sum total of your identity either. And so that can only happen if validation happens first. The client has to know, oh, Dr. Muller, he gets it that I've suffered, so that he, it doesn't feel like I'm minimizing their experience. It's a tightrope, actually, walking this with clients. But that's part of good trauma work.
Got it. Yeah. So it seems like, it comes down to having certain like addictions, like, porn addiction or drugs or or, sex, or obviously, drinking alcohol is a big one. And you kind of went in on labels as well, just like labeling who you are, people telling you that, or just you telling yourself that, and just not really getting to the root of the issue. Right? Like
Exactly.
not really going into it. So I guess anything that's not healthy pretty much takes you away from actually getting to the root. Because if you don't get to the root, you can't really figure out what's happening, right? So like, would you say like that's what it pretty much, like goes around?
That's a nice summary.
Got it. That's interesting. Okay. Yeah, because obviously online, if you go online, you'll see it everywhere. It's just like you always go to the extreme on either side. Like it's just like there's nothing that's like in the middle. Like yeah,
I mean, there's some. I mean,
some. That's right. Yeah,
there's
some.
some
That's
good
right. Yep.
websites about trauma. I mean, I actually have an online magazine, the Trauma and Mental Health Report. It's free, so I'm not plugging anything.
Yeah.
But it's a free online magazine, the Trauma and Mental Health Report. We publish it out of my university, York University in Toronto, and it's got good, accurate information on trauma and mental health. The Mayo Clinic website in the U.S. Well, I haven't checked it lately, but my understanding is that it's quite a good website for PTSD. And there are some other good places as well. But it's you got to be really careful about what information you find, and being thoughtful about getting accurate information about trauma.
Got it. Okay, that's great. So let's just talk about like different ways that you try and help your patients feel safe with you, and just slowly help them to really like eventually open up, because like your whole book is about they struggle to open up, right? Because like they don't really know how to open up. So one of the things that you mentioned was a holding environment, right? So can you explain what that really is, and why does that help the client?
So the idea of the holding environment comes from the work of Donald Winnicott from the 1940s. I know it seems like a really long time ago, but some of the best psychoanalytic work was done in the early half of the 20th century. And of course, there's lots of criticisms that you can levy against psychoanalysis. And I've heard them all, and I agree with many of them. But there's also a whole lot of really smart stuff that came out of the work of the early psychoanalysts. Anyway, he was an early analyst. Donald Winnicott trained as a pediatrician, and he really likened psychotherapy as being like the relationship between, at that time he was talking about mothers and babies. Nowadays we would say a caregiver, mothers, fathers, and their infants. And you might say, well, how does that relate? It relates metaphorically. It really relates metaphorically in the same sort of way as a parent, when their when their little infant is crying, when their infant is sick, they need, before anything can happen, if you've got a 2-year-old kid and they fall and hurt themselves, before any kind of let's get back on the horse again, or let's get back on your bicycle again, Timothy, after you skinned your knee or whatever, before any of that can happen, Timothy's crying. He just needs to be held. And it's not rocket science. It really isn't. It's just like Timothy's crying his eyes out because he fell off his bike and he skinned his knee. Before anything can happen, Timothy just needs you to hold him. It might not take very long. It might be 30 seconds, and then Timothy stops crying, and then Timothy's, sort of sniffling, and then, okay, let's fix this knee. Let's go put a Band-Aid on it. All right. And then eventually, hopefully within the next couple of days, get back on the bike, maybe soon after that, whatever the case may be. But he talks about the priority, Donald Winnicott talks about the priority of the holding space, actually literally, so physically holding. Now, I'm just talking about in psychotherapy. Actually, I don't advocate touching your patients. I'm speaking
Yeah,
about this metaphorically, just to be perfectly clear here.
absolutely.
It's a holding environment. It's a space that provides a sense, a feeling of being held, a sense of being safe, a sense of being cared for, a sense that your therapist is interested in what you have to say, a sense that your therapist uh, uh, feels for you, and also has a sense of optimism on your behalf, that this can be something you can um, move beyond eventually, so that you're not feeling like they're they're colluding with you. A holding space isn't, oh yes, everybody's so terrible, you're such a victim, the world is horrible. That's not a holding space. That's colluding with the client's suffering. And you don't want to be colluding. You want to be empathic. You get what they're feeling. You can understand what they're feeling. And it has an impact on you. You're not just a, neutral bystander who couldn't care less or whatever. No, you care. You do care, and it has an impact on you. And there's a sense that you can help the person move toward a better life. So there's a kind of a sense of safety, a sense of togetherness. Here's the other thing with the holding space. We haven't talked about the therapeutic relationship. One of the best predictors of outcome in psychotherapy, and this is true for trauma therapy as well, is the therapeutic relationship. What kind of relationship do you have with your therapist? Not one where you feel that you're trying to make the therapist happy, not one where the therapist is constantly colluding with you, but one where the two of you are working together toward the goal of helping the client have a better life. That's ultimately what the therapeutic relationship is about. It's an alliance between therapist and client. And so the holding environment is about providing space for that kind of alliance to develop. The holding environment also has a frame to it. So, we talk about the therapeutic frame in psychotherapy. So what's
Yeah.
the therapeutic frame? The frame is a set of guidelines that structure the nature of the relationship. Trauma clients are terribly sensitive to violations of the therapeutic frame. You may think you're doing your trauma client a favor by inviting them out for coffee. Listen, this person needs a friend. Yes, we talk in psychotherapy, but I'm just going to invite them to Tim Hortons. I'm Canadian, so Tim
Yeah, me
Hortons.
too.
I'm just going to invite them to Timmy's for coffee. It's not a big deal. It really is a big deal. It's a real problem. Violations of the therapeutic frame lead the client to feel unsafe. And so the therapeutic frame refers to the structure. We meet on Wednesdays at 2:00 in my office. I'm not going to be coming over and hugging you, like it's a safe space where you have your space, I have my space, but you will feel understood by me, or I'm going to try. My goal is to help you feel understood, to help you feel cared for, to help you feel like there's hope. All of that is part of the structure, but the boundaries of the therapy are very clear and they're very consistent, in the same sort of way as my boundaries. I have 3 children. My boundaries with my children are clear. I'm their father, and I don't say inappropriate things to them, and I don't say inappropriate things to my clients. There's boundaries, and I might talk with my friends in ways that are different than I talk with my children, or in different ways than I talk with my 1-year-old granddaughter. We have boundaries around the different relationships that we have in our lives, and they create a sense of safety and they're really helpful. So that's also an important part of the holding environment, is that there's a frame to it. And that frame brings a sense of safety.
Got it. Okay. So you mentioned the stages for the framework, right? So there's like three main stages that you talk about in your book, from like safety to trauma processing, and then to like growth, right? So that's all, like a part of the holding environment. So since like obviously that's kind of the major framework here, and then if you violate that, it's going to make the patient feel unsafe, right? So can you just go a bit, like deeper into how that framework actually works, and like what about it makes it really effective when you're working with the client?
Well, so the frame of psychotherapy is the context, and so it doesn't describe what you actually do.
Hmm.
It describes the stance that you have in relation to your patient. So, like I say, the stance that I might have with my friend who I go swimming with on Monday nights, we joke around. We have a convivial, we have a friendship stance, and the kind of relationship we have is, as I say, fundamentally different in terms of the structure of it than my relationship with my wife, or my relationship, with whom, we're sexual, we're friends, we're intimate, we're partners, we're best friends. It's a different kind of relationship. There's a structure to it. And so it has to do with the structure. The nature of the relationship is the frame. So beyond the structure of the relationship, so with clients, the structure of the relationship is one where we have an agreement that we will meet in my office, and we will only meet there, and we will talk about issues not relating to me and my personal life, but there will be issues relating to the client, and the client doesn't know a lot about me, maybe a little tiny bit, but not a whole lot. They know that I'm a male, they know that, but they don't know a whole lot about me, a little tiny bit.
Mm-hmm.
But I know a whole lot about them, because our goal is together to work on improving their life. So that's our therapeutic structure, and that's the frame that we operate in. Now, within that frame, how do you do trauma therapy? Well, there are three stages to trauma therapy, and the first is establishing a sense of safety with the client. And the second is trauma processing, and the third is called reconnection. So the first stage, which is safety, how does that work? What you're doing is you're helping them, first of all, feel safe in the therapeutic relationship. And so you do that by having a clear frame. You do that by having predictability. You do that by making sure you don't say things that you wouldn't say to a patient, but you don't say the kinds of things you might say to your friend or your wife or your children. You say the things you would say to a patient, which is very much focused on their history and in helping their lives. So you create this sense of safety through a very clear structure. You also can create safety because what you do is you bring the relationship into the room when things um, go wrong, or when you see clients say things like, um, Dr. Muller, last week, I'm so sorry. I know I was really boring with you. And I might say to them, Kyle, can you tell me a little bit more about that? Well, I don't know. You seemed a little bit distracted. What's happened there is I'm sensitive to the idea that Kyle has brought the therapeutic relationship into the room. Now, I don't know what happened there, but something happened where maybe he perceived my behavior in a certain way and came to the conclusion that he's boring. I don't know how we're going to unpack that, but we will. And what I will do is I'll say, help me understand better that moment that you imagined or thought or felt like you were being boring with me. What was going on? Well, Dr. Muller, you were sort of staring out the window, and I wasn't sure what was going on for you. And so I might realize, oh, hang on a second. This client maybe is picking up on something. And I might wonder to myself, was I a little bit distracted last week? Was something going on for me? The therapeutic relationship has been brought into the room. And so what I often will say to clients at that moment is, I first of all will stop for a moment and say, let me think about that for a second, Kyle. And here's a common thing. As I think back, I was a little distracted last week. And I think you might have picked up on that. And I'm wondering what that's like for you. What was hard about that for you? Now, I'm not sharing with him details about my personal life. I'm not telling him why I was distracted. But what we will do is we'll unpack what happened between the two of us so that we can create a safe space so that he doesn't have to hold on to this idea that he's this boring client and that I don't care about him. And I don't know where we'll get to, but I do know that by opening up discussion like that, what it does is it creates a situation that deepens our therapeutic relationship. And he can feel like he can tell me something about what's going on without me getting defensive or me getting upset with him or me blaming him, but rather me being curious and compassionate and supportive. And what that does is it builds a sense that people are actually trustworthy, which is something that trauma survivors very often don't have. And so that's just step one, safety in the relationship.
Yeah, yeah.
Step two is you start working with the person around actually talking about their trauma story. So that's trauma processing. And that's where they tell their story in detail, and you're curious about their feelings, you're curious about their anxieties about it, you're curious about what it's like for them to share this story. And as they do that, they become more comfortable with this aspect of their life. It becomes less of a burden that they're carrying around. And you do this over the course of really a few months of
Really.
work together. It can take a long time. And it's not just, it's not like just a stepwise process. They'll go back and forth on different processes, but this is something that can take a while. The third major step in trauma work is called reconnection, where you're helping them create connections with other trauma survivors in their life, not necessarily in their life, but in other trauma survivors, and to bring the idea of I'm not alone into their life. And so I actually have an online group that my colleague and I have put together called Trauma Practice for Healthy Communities. And this is an online program that people can look up, and it's also free. It's run by a charity. And so people can join groups through this, and they can learn, first of all, about some grounding strategies, deep breathing skills that can help them feel a little bit safer in their everyday life. But they can also hear a little bit about other people who have been through certain experiences, and this leads them not to feel so alone. It leads them to feel like, okay, there are others who have also been through this kind of thing. Very often trauma survivors really feel alone. And so this kind of reconnection to other people is an important piece of the work. So those are really the three kind of stages of good trauma work that I recommend if people are doing trauma work, that they help their clients proceed through.
God, yeah. So it seems like, if you really want to go on to stage two, which is where you start to process the trauma, it really comes down to like the client has to eventually start that process, right? Like, would you say that's the thing, or should people try and pry? Because you mentioned like in your example, oh, your client said, oh, last week I was kind of boring. I'm sorry about that. So he's not really opening up, but kind of opening up, right? And then from there, you can kind of,
Exactly.
go a bit deeper, right? So like, should you wait for them, or is it okay to pry?
So it's an interesting word, pry.
Yeah.
Cause it's a very active word. I think of carpentry with prying, like no.
Yeah.
No, but it's a good word because it's a very active, intrusive thing. And I think many trauma survivors, if it's not done well, will feel like you are prying. You're trying to pry them open. And that feels unsafe. Yeah. That feels threatening. So you're right. It's a good word because it can be felt that way. But then there's another risk on the other hand, which is sometimes you get people who've come to therapy because they have a trauma history. And the therapist says, well, you know what? Kelly will talk about this when she's good and ready. And maybe Kelly has implied that she has a trauma history because when you asked about, what sort of strategies did your parents use to teach you the difference between right and wrong when you were a kid? And Kelly says, well, my mom used to, She used to give it to me good, let me tell you. But yeah, I mean, I guess she was a pretty good mother. So she's dropped a little hint there
Yeah.
that something's going on. But then the therapist says, well, I'm not going to ask about it. I'm not going to pry. What ends up happening possibly is you could do 3 years of therapy with Kelly, and you're avoiding the topic and she's avoiding the topic, and you never get to it. And that's not helpful either. So how do you do it slowly? What you do is this. You listen for trauma fragments. So there's a term in trauma literature called trauma fragments. So what are trauma fragments? I gave you an example with Kelly. You asked Kelly a simple question. So tell me about your mom. How did she teach you the difference between right and wrong? How did she convey that? It's a very normal kind of therapy question, understanding how you learnt your moral fabric. How did you learn, what went into building your moral fabric? How did your mother teach you the difference between right and wrong? And Kelly, and it's perhaps an innocent question, and Kelly answers, Kelly answers with,
No
sorry.
problem. No problem. No problem. No problem.
Kelly answers with, well, what she did was she gave it to me really good. That's what my mom did. That's a trauma fragment. Why is that a trauma fragment? You didn't ask about whether her mother punished her. Kelly offered that up. I don't know what that means, gave it to me good, but
Yeah.
I would be curious about it. Now, if Kelly said that to me in the first session, I may not ask her in that first session, but I would certainly come back to it. Or I give some examples in my book, Trauma and the Struggle to Open Up, where I asked a client the person described their mother as being a good mother. And I said, well, tell me some stories about her being a good mother. And what he told me about was a story about how his mother tried to abort him when he was an infant, when he was a fetus. Now, that's not a story about having a good mother. That's a weird answer that makes no sense. But it's an example of how people sometimes will drop trauma hints along the way, even without going into detail. What you want to do is you want to notice those trauma hints and come back to them. You want to come back to them when it makes sense to do so. And you might say, well, the person told me about this 2 months ago. Should I bring it up? And I would say, if it makes sense thematically, absolutely. So in the example of somebody saying that their mother, let's say Kelly, you ask Kelly, well, tell me what you mean by my mother gave it to me good. Oh, well, just sometimes she would spank me until, I don't know. I mean, it could be pretty bad. Sometimes I had to miss school. Sometimes one time I had to go to the hospital. But again, she was a good mom. Don't make a big deal out of this. Again, right? No. So and then Kelly, let's say 2 months later, is talking about her friend who spanks her kid and how upset it makes her. I would use that as an opportunity. I would say something like, Kelly, it's so interesting. You're talking about your friend and about how uncomfortable you are when you see your friend spank her son. Is that similar or different than the story you told about your mom and when she spanked you? Is that, help me understand this. And she says, oh, it's totally different. How's it different? Tell me how it's different. I'm curious about that. So I'm not going to contradict her, but I'm going to bring the story into the room. I'm going to bring that trauma fragment back into the room and be curious about it. What therapists will find is if they do this, if they listen for trauma fragments, bring them back into the room, ask questions with curiosity, ask questions in a non-judgmental way, people's natural desire to share and to be understood will take over, and they will start to open up. They will. Because trauma survivors, even if they're generally people who are avoidant or they try to minimize things or sidestep things or use drugs and alcohol to cope, and they avoid dealing with their emotions, even those people deep down are yearning to be understood. And if you listen and pay attention to these trauma fragments and ask about them with curiosity, then and patience,
Hmm.
you'll find that even without that much time passing, people will start to open up and they will be interested in sharing, and they will.
God, yeah. So I just have a question about these trauma fragments, right? So you pretty much talk about this and like revisit the topic soon. You know, like in your book, like that's one category, right? Now, here's the one thing for me, because I mean, this might sound kind of dark, right? Because sometimes people they just give away signs that they're not in the best mental space, but then they do it in such a subtle way, right? So you might notice it, but like they didn't really go deep enough to make it too alarming, right? And then next week they might like kill themselves. Like I've had stories like that happen, right? So in those moments, right, like when it comes to trauma fragments, like how patient should you really be? Because like you don't want to wait too long to the point where they might do something negative to themselves, right? Because like like in this case, you mentioned that hey, sometimes like 2 months down the line, you can kind of go back to it if they kind of mention something similar again. But like, what if people are worried about it being too late? You know what I mean?
So that's an excellent question. So I made the assumption in that story,
Mm-hmm.
and in it's actually based on an actual case
Oh, is it?
that I talk about in Trauma and the Struggle to Open Up. And in that case, if folks are interested, it's in chapter 2, the case of Nicholas. In that case, Nicholas was not actually at risk for suicide, and so you're 100% right. So we just hadn't gotten to this issue yet, but part of what is important when working with people with PTSD or other trauma presentations is to do a careful suicide assessment. Is this person safe? For clients who are unsafe, absolutely, you need to develop some kind of agreement that they will tell you if they are starting to develop a plan to hurt themselves, if they intend to hurt themselves. And you might say, well, why would people tell you? Well, if they really want to hurt themselves, wouldn't they just go do it? And I would say to you, yes, they would just go do that. But if people are coming, those are not the same people who are coming in and talking to a therapist. People who are coming in and talking to a therapist are reaching out. They're saying, I'm suffering. They may not know how to talk about it, and they may not feel that there's hope, but there's a part of them that wants to be understood and wants to be heard. And so if, it's common practice early in therapy to ask about symptoms of depression, to ask about safety. So you would want to make sure you do that. If the
Mm.
client is fundamentally not safe, then absolutely part of your ongoing work is to do a safety assessment. And you want to do that in an ongoing way with folks until they are out of the woods and their depression has if not lifted, it's now manageable. And I work with psychiatrists as well. There are folks who I see who come in and for the first couple months of our work together, it's really just about keeping them out of the woods, and all we're doing is we're just doing basic safety work around their everyday life. And I'm referring them to a psychiatrist for medication. And I'm also working with them around trauma-informed yoga, just to start to have some strategies to build some meditation skills, as well as until the antidepressants kick in. And antidepressants, I find, are helpful for many people, not for everybody, but for some people. And so, and then, of course, that's very important. So I agree with you, and you do want to make sure that you do a safety assessment. By the way, I want to do, before we run out of time today, I
Yeah.
want to do a plug for trauma-informed yoga. I don't teach trauma-informed yoga. It's not but I will say that it's one of the techniques that early on in trauma work has been really helpful for people. And there's really good research especially during the safety phase, during stage 1, before people even start to talk about their trauma story, before they start to process their trauma, to be able to learn some meditation skills and to learn some yoga skills through there are online programs for trauma informed yoga. It's there's been good research to support it, and I strongly support folks using that as an initial strategy to start to bring some relief. So I just want to put that out there. I know you didn't ask about it, but I'm putting
No
it out.
problem.
Just something that I think people will find very interesting. Trauma survivors find it very helpful.
Got it. Okay. Yeah. So, like as you mentioned, we're slowly clocking down on the time here. I can talk to you about this all day. This is a really interesting topic. So just before we go, if someone is out there and then if they're struggling in silence and then they don't really know how to get help, but they know they should, what would you tell them to like do like how can they approach, like what would that first step be? Because everyone pretty much knows about that, right? Like especially nowadays because it's talked about so often. So like what would that first step be if they don't really know what to do and then they're just keeping everything in themselves?
Well, there's some good books to read. There are some good. There's some good. I would say even if you think you have a trauma history and you don't think you're ready to do psychotherapy or counseling, like it just feels like it's a big step for you, I do actually think that trauma informed yoga is a really good
Okay,
place to start. I really
that's
do.
interesting.
I
Yeah.
mean, it's not. It doesn't ask people to talk about their story. It's literally just yoga, but done in
Pretty
a way
interesting.
that's sensitive to people who have, um, uh, you know, who have a difficult past. And so there are certain ways in which they certain strategies that they apply, or certain techniques that they apply, that just sort of make the whole thing a little bit easier. Some people do find traditional meditation very difficult. So trauma informed yoga is easier for people who have a trauma history. So I would actually recommend doing that as a good place to start. Martial arts is another thing that people don't realize, I mean, is unbelievably helpful for trauma survivors. If you have
Yeah.
a trauma history and you're just like, listen, talking about this is uncomfortable for me. I'm listening to this video. It's interesting, but I'm not there yet. Martial arts. I mean, just straight up
Mm,
karate, and other kinds of martial arts. They build confidence. It builds discipline. It builds a sense of, and it should be a place that is not competitive and overly aggressive. So I would say a studio, a dojo where it has a reputation for being a little more on the gentle side. I mean, like a positive, supportive environment. I mean, of course, martial arts is it's using your body and finding ways to use your aggression positively, and so. They're always going to, it's martial arts at the end of the day,
for
but
sure.
there are some that are some dojos where they take a more uh, um, caring kind of approach toward the participants. So just that would be the only thing that I would put in there. There's also martial arts for people who are trauma survivors. So that's another thing that people sometimes get involved with, specifically for that. So those are really good things that I would say for folks don't feel that they're ready yet to. But otherwise, I would say you can start the process of trauma informed counseling, trauma informed therapy. Find a therapist who's trained in trauma, a therapist who actually yeah, who's gotten good training. Buyer beware. There are some crappy therapists out there. And I'll be honest, there are some, not good therapists out there. Whoops, I don't know what's going on there. Um, there are some not so good therapists out there. So, you know, be, be cautious. Make sure you do your homework on therapists, and if you feel like that it would be helpful, set up a little meeting with them in advance to ask them about their approach, ask them about their training. How did they learn? Have they worked with many trauma survivors? That sort of thing.
God, yeah. So it seems like, starting kind of like with the body, right? With, trauma informed yoga and like martial arts, which obviously is extremely helpful because, it's not just like a physical thing. Like you're with a lot of people as well, right? So there's a huge like social component to it as well. So those are great places to start if you want to start on like a physical level. But if you don't want to do that, if you want to go non-physical, then you would recommend do work to try and find a good therapist and slowly figure out how they approach it, and then kind of go from there.
Yes, I would say that that's all true. I would also say art therapy and music therapy for trauma is also helpful for folks who don't yet feel comfortable talking about their story. So there are trauma-informed art therapists and trauma-informed music therapists as well.
Really?
Yes, and
so it's about the expression, pretty much.
Exactly. So it's the therapist is aware that the person has a trauma history, but doesn't sort of ask them about details, but helps them find ways to express different feelings, and so that can be very helpful. Many people find it very helpful, and I strongly support it.
Got it. Okay, art therapy, music therapy. Okay.
Yeah.
Well, Dr. Muller, this was a fantastic episode. Thank you so much for your time.
Yes.
This is a long time coming. We've had to schedule this quite a few times, but finally we got this done. If people were to go and find your work, where would you tell them to go?
So I have a Psychology Today blog. You can find me there. So if you just Google my name, Robert T. Muller, make sure you put in the T, just if you to be able to find me easily, or Dr. Robert T. Muller, or Robert T. Muller, Muller, psychologist. Then you'll find my Psychology Today blog. You'll find my my online magazine, the Trauma and Mental Health Report. And you can find my books, Trauma and the Struggle to Open Up, and Trauma and the Avoidant Client. And so those are some ways that you can easily find me. And my email and phone number is easily, these are all my professional email, professional phone number are all totally available online. If you just Google my name, you'll find me under, contact information.
Got it. Okay, we will link everything in that video description, and people can go and check it out if need be.
Okay, great.
Okay, well, Dr. Muller, thank you so much for this. I really appreciate your time, and maybe sometime down the line we can do another episode and go even deeper on this, which would be good.
Fantastic. Thanks so much, Shaq.
No problem. You have a great day.
You too.